why don't you, introduce yourself to the audience, and then we'll get started.
Hello, my name is Dr. Richard Benson, and I'm a neurologist, and I'm a program director and direct the Office of Global Health and Health Disparities at the National Institute of Neurological Disorders and Stroke within our Division of Clinical Research.
Great. Thank you so much for being with us today and talking to the Heart and Soul audience. The first thing I guess I want to ask you is, what is the Mind Your Risk campaign? What exactly is that?
The Mind Your Risk campaign is a really novel public health campaign that we're really excited about. The goal of the program is to raise the community knowledge about the link between uncontrolled hypertension and stroke and dementia, particularly in one of the groups that's at highest risk for developing dementia because of uncontrolled hypertension, and that's African American men. We'd like to catch people before they actually develop dementia, and so we've geared the campaign specifically to African American men in midlife, and we define that as between the ages of 28 and 45.
Wow, the age range seems pretty young. I think most people don't think of a 28-year-old as somebody that would have a stroke. I mean, wow, I'm surprised.
That's true. Well, a couple of things. I mean, when you think, unfortunately, when you think of the life expectancy of African American men right now, it's around 68 years. And so really that falls right in midlife. African American men have the lowest life expectancy compared to a lot of other groups. And so that's one thing. But again, that's that age where we can really modify this path if we catch people early. And so that's sort of the purpose of the campaign, to get people to understand that connection and then do what they can to change their health trajectory or take charge of their health.
Okay. Well, let's go back to the beginning. Explain to people exactly what is a stroke.
A stroke is when you get a blockage. Well, there's two types of stroke. Let me take a step back and say this. There are two major categories of stroke. One by far is the most common, and that's an ischemic stroke. And that's about 87% of all strokes. And that's due to blockage of a blood vessel in the brain. That leads to permanent damage of the area of the brain that's supplied by that particular blood vessel. And so that's what an ischemic stroke is. A hemorrhagic stroke is when a blood vessel in the brain bursts open and you have bleeding in the brain. And that also leads to damage of the area supplied by that particular blood vessel. And so stroke is it's the fifth most common cause of death in the United States. It's the second most common cause of death worldwide. And it's the major cause of disability here in the United States. So it's a lot of disability and death associated with stroke.
Wow. Now, so if we're sitting in a room, how would I recognize if somebody's having a stroke? What are some of the signs?
Well, the key thing with stroke is the sudden onset of symptoms. So it's a sudden change in someone's neurologic functioning. And we use the acronym FAST because it's easier to remember.
Okay.
FAST. The F stands for facial weakness. So the sudden onset of facial weakness on one side of the face. Arm weakness. We can ask people, or someone can ask a person to lift their arms in the air straight in front of them and see if one arm drifts down faster than the other. So arm weakness. Speech problems. So if someone has really slurred speech, someone that normally speaks and articulates very clearly, who starts to develop slurred speech or difficulty getting words out, that's the S for speech problem. And the speech problems, and the T is for time, meaning call 911 immediately. Approximately 70% of all strokes will have one of those three symptoms associated with it: facial weakness, arm weakness, or speech problems. And so hence the acronym FAST.
Okay. That's excellent. And we'll make sure we have that graphic down in the piece so people can remember that. Now, why are Black men at such high risk? Is it because of high blood pressure? What exactly is why are Black men seems to be,
High blood pressure is that's the modifiable risk factor that has the highest attributable risk for stroke. Let me break that down.
Okay.
We divide the risk factors for stroke into those that are non-modifiable, meaning you can't do anything about it, like age. We do know that people, as you get older, your risk for stroke goes up. We know that if you have a family history of stroke, that increases your risk if you've had a stroke before. So those are things that we can't change or do anything about. Also, men tend to have more strokes than women. However, women tend to live longer. So if you look in society or community at a particular time, there are going to be more women with strokes. And so those are what we call factors that are not modifiable. But the modifiable risk factors for stroke, high blood pressure is the major one because it's highly prevalent. 1 in 3 adult Americans have high blood pressure. 1 in 2 African Americans have high blood pressure. And it's highly associated, it's highly prevalent and highly associated with stroke. So that's what we call the attributable risk. So high blood pressure is a major modifiable risk factor, and it disproportionately affects African Americans and Hispanics.
Wow. Okay. So, so we have this high risk. So what are some of the things that folks can do to, modify that risk, or is it diet and exercise? What are the key things that you would recommend people do to help, prevent stroke?
No, I think that's a great question. I think as I go to answer that, I want to come one of the common questions we get is, so why do African Americans have this higher risk of high blood pressure compared to other people? So that's a great question. There are a lot of theories. There's no solid reason that we can point to for that. Some of it could be biologic. Some of the biologic theories that are out there is that during the Middle Passage or the transatlantic slave trade, that the people that made it from the western coast of Africa over to the Western worlds, to the United States and the Caribbean, were the people that were able to retain sodium or salt in their system. And so they didn't become dehydrated. And so a lot of African Americans or Blacks are very salt sensitive. And so that could be a sort of a natural selection, or that created some epigenetic effects that led to that. And so salt is one major thing. So, and African Americans tend to have a lot of salt in their diets.
Yeah.
Some of it is cultural in terms of seasoning foods with salt. The types of foods in terms of a lot of meat, a lot of fried foods. Historically, the types of diets that people have had just were not, people of color, were not the most healthy diets. And so that's a major piece. So diet is a major factor. Obesity is another factor that as people tend to gain weight, your blood pressure is higher, as well as your blood sugar, your cholesterol, and all of those factors that put people at risk for stroke and cardiovascular disease. And as we're mentioning with this campaign, also consequently dementia. So those are risk factors. Decreased physical activity, people not moving around a lot, is an
like being on Zoom calls all day, right? Like
exactly. So some people like to stand, which you can burn a few more calories there, but it's best to do some physical activity. Even we found that 10-minute increments of physical activity to get your heart rate up 3 times a day. So that's 10-minute increments to give you 30 minutes a day, at least 3 times a week. That can lower your risk, increase your physical activity, and lower your risk of stroke and heart disease.
Also, just going for a 10-minute walk 3 times a day could be helpful. Oh, that's fantastic.
That could be very helpful, going for a walk, definitely to get your heart rate up. Also, it's important in terms of decreasing stress, which is another thing.
Right. That was another question. I know stress is a big factor these days. So
yeah, that's very, yes, there's a lot of stress in the world. So getting up and walking around is very good for decreasing the stress, increasing your heart rate, and at getting that physical activity in.
Okay. Let me ask you another question. We hear about people having stroke, but what percentage of folks that have a stroke actually get back all of their capabilities or functions?
It's an excellent question. Most people that have a stroke, the majority will have some type of deficit.
Okay.
However, it may vary in terms of the degree of deficit. There are certain treatments if people get to the hospital early, particularly with ischemic strokes, the category where I mentioned that 87% of strokes are ischemic in nature or due to decreased blood flow through a blood vessel.
Right.
We have treatments. One of them is called tissue plasminogen activator. It's a drug that was found to be effective at busting clots in the brain through a clinical trial that was actually sponsored by the National Institute of Neurological Disorders and Stroke. But the medication has to be given within 4.5 hours.
So it got to be fast. You got to get there quickly.
Has to be very fast. In some instances, with the proper imaging of the brain, we may be able to give TPA. Even more recently, there are other theories that people have a clot of a larger blood vessel in the brain. We have interventionalists that can go into the blood vessel vascular system and actually remove the clots in the brain. And that can be done in some instances up to 24 hours. Depending on the type of stroke and the amount of damage that's done. But all of those that's pretty fast. Unfortunately, some people don't recognize that they're having a stroke and they sit at home and don't come until late. And so they can't get these treatments. Right. And so it's very important to get to the hospital early. And so if you get these treatments, then you have a higher chance of having less disability. These treatments that I mentioned decrease the chance of you having major disability, and you have more positive outcomes with less disability.
Okay. So I mean, we all have cell phones and, smart watches and stuff. Are there any devices that people have that, I mean, Black folks over-index with mobile phones. So are there any devices or anything we should have in the home to help us, take care of our blood pressure or recognize that something is going on that you would recommend?
I think there are good devices, smartphones that actually measure your heart rate, which is, I think it's good to know your heart rate.
Okay.
There aren't good smart watches that actually measure your blood pressure, but there are a lot of automated blood pressure machines or monitors that can be purchased in any pharmacy. And we do recommend that. We do know that people that check their blood pressure on a regular basis actually have better control of their blood pressure. The normal blood pressure should be less than 120/80. So if it's above that number, it's elevated. A blood pressure, I've seen people have strokes with blood pressures of 150/90, which may not sound high to people. Right. The normal blood pressure is less than 120/80. And we suggest that people check their blood pressure at home with a cuff while sitting down with the arm at the level of the heart, and do that at least every 2 weeks. And then write that information down. We on our website, the Mind Your Risks website, we can add that to the screen.
We'll do that.
If you go to the website, we have information there where people can actually look at and evaluate their risk based upon the risk factors of stroke. And actually on some of the forms as well, people can write down their blood pressure numbers and save that information and take it to their medical provider when they go to get checked out.
That's excellent. That's excellent. So I had another question. So, a lot of Black men just won't go to the doctor. What do we have to do about that? I mean, once or twice a year doesn't sound like it's enough to know what's going on with your numbers.
That's a great point, Clarence. And that's why I'm really excited about this particular campaign, the Mind Your Risk campaign. We want to empower people. And so some of the messages that we have, like the one that you can see above my head, you have a brilliant mind. Don't risk losing it to high blood pressure. Another one is no one can lower your risk of hypertension and stroke like you. We like to empower people to try to make these healthy behaviors the norm. And
Okay.
so that's what we have to do for African Americans, to get people to take charge of their health and do what they can in order to develop a healthy lifestyle, a healthy diet, good brain health, and also to find a good medical doctor where they can go and get evaluated. So we have to make that a norm. So that's why I'm really excited to partner with you and to speak with you today for your listeners to make this part of their conversations, the men and women in their lives, to make this the norm.
Okay. So it sounds like we got to get everybody in the family involved, especially to get us men to go to the doctor. It's, I don't know what it is, but yeah, it seems like we need everybody involved to help protect ourselves.
For a lot of men, that their health is not a priority. They have other sort of competing priorities there, trying to pay the house note, car note, or put food on the table to take care of their families, and their own personal health is at the bottom of that priority list.
Right.
Same thing for women, but yeah, men too, particularly, just don't focus on their health because it's not a top priority until it's an emergency.
Right. Now, what else would you want the audience to know? Would you tell them about World Stroke Day that's coming up, and what should they take away from that?
I think it's important to know that that dementia can be, a lot of people understand that stroke and cardiovascular disease, and that there are things that they can do to modify their risk of those. But a lot of people don't know. We found in some of our research, a lot of people don't understand the connection between dementia or memory loss and uncontrolled high blood pressure.
Right.
Uncontrolled high blood pressure is bad in general. It's going to be bad for all of the organs in your body, particularly the brain. And you can live for a long time with memory loss and dementia, but that's not living a good life. But it is preventable. So that's a key message, that you can prevent developing dementia due to uncontrolled high blood pressure. And also you can prevent or lower your risk of having a stroke or heart disease as well. So that's sort of the key message, by doing some of the things that we've talked about: physical activity, stopping smoking, better diet, decreasing the salt in your diet, taking your medication if you have diabetes or high cholesterol.
Right. Yeah, I have diabetes, so I take medication. And it seems like lately I've got a lot of friends and family members that have gone through a stroke or mini stroke or what have you. And it's very, very scary for caregivers and families to have to deal with this. And a lot of people just don't know what to do or how to handle it. So it's not just the men, but it's the families around these men that have the responsibility of taking care of them when they don't have their full capacity anymore.
No, that's a really excellent point. Having a stroke or a heart attack or developing dementia, that it definitely impacts the person, but it also impacts the family for multiple reasons. And so we have to think about that, particularly if we have someone that's developed dementia and needs assistance. That actually puts a lot of responsibility on family members to try to take care of that person. And sometimes people don't like to use this term, but it puts stress or sort of a burden on that individual, and the person is conflicted because they love their family member, but yet it is stressful, and it's hard for that person to continue to do those things that they have to do in life when they're caring for someone else, even though they want to do it, but it is a lot. So there's a thing called caregiver burnout.
Yes.
That people are looking at and trying to find ways of addressing them.
Yes, absolutely. Yeah, I have a friend now. Her sister had a stroke, and she was just an absolute wreck. She had to go into physical therapy and everything. And it was like you might have to find her a nursing home to help her through that time period. And some family members can't even deal with it at all. They're like, yeah, they can't even begin the process of helping their loved one to get back as much as they can get back.
No, that's an
I mean, I just converse a little bit more. Yeah, my mother had a stroke, and it took forever for her to get back to like 80%. But she was, in her 80s, and literally, I have a friend now that's been in and out of the hospital, not only with major strokes but with mini strokes, and we don't know what's going to happen. And it's just like this seems like it's so prevalent. But he was a smoker. There's all these factors, like you said, that come into play if you don't take care of yourself and you don't realize that it's not just you that's going to be affected, it's your entire family and your loved ones. So
no, that's a great point. And I think the other piece to this is that if someone does have a stroke, we'd like to prevent a stroke. And so that's why
of course,
prevent a stroke. But if you have a stroke,
mm.
while you're acutely in the hospital, it's important to have a good workup to determine why the stroke occurred. So going to a good facility where you get what we call a full workup, where they monitor your heart rate to determine if you have an abnormal heart rate or atrial fibrillation or a clot in the heart. Also look at the arteries in the neck and the brain to make sure there's no what we call carotid disease or stenosis or narrowing of the arteries in the neck or the arteries in the brain, as well as doing an echocardiogram as well. And so all of those things are important. And then being on the proper medication to prevent another stroke from occurring. So those are sort of the big pieces.
Fantastic. Well, I want to thank you for your time and taking the time out. I know you've been on the website before, but it was just Q&A kind of text, but this is great to talk to you in person and to see you so that folks can realize that there are real people out there really trying to help them with their health and to help them to live longer, more productive lives. So I want to thank you so much.
Oh, thank you. I appreciate that.
Say the website where people should go to get more information, if you don't mind.
Yes, it's www.mindyourrisk.nih.gov. So that's www.mindyourrisk.nih.gov.
Now gov, right. Okay. Well, I'll make sure it's on screen and everything so people can get that information. But again, thank you so much. And thank you for your time.
Okay. Thank you as well.
All right now.
Bye, everyone.
All right. Take care.